The World Health Organization calls it an extraordinary event, the most severe Ebola outbreak ever. And it says there must be a coordinated international response to stop and reverse its spread.
The committee's conclusions and my decisions are a clear call for international solidarity. Countries affected to date simply do not have the capacity to manage an outbreak of this size and complexity on their own.
The official statistics say 932 people have died so far, and that number will rise. Guinea, Liberia and Sierra Leone are the countries most affected. In Liberia, troops at roadblocks trying to halt the spread of Ebola. The WHO wants all the affected countries to declare national emergencies. But they've been plagued by civil unrest. Their health services are weak and inexperienced. And here in Guinea, a sick man is left to lie in the street for hours. The WHO says fear, both in the countries already affected and in the wider world, is one of the major challenges. So it's not calling for a general ban on international travel or trade. All governments need to be vigilant and ready, it suggests, but the main focus of concern remains West Africa.
The outbreak will definitely be brought under control, but when that will occur, I don't think that any of us can second guess. This is an immensely challenging, difficult, and I think a little bit unpredictable outbreak.
The affected countries urgently need more specialist equipment and trained personnel. But with no proven vaccine, should international aid also include experimental drugs?
I think there's a very good humanitarian case for using these drugs, but we don't really know enough about whether they'll work or how they work to be sure we can rely on them. And it's also going to take a considerable amount of time to make enough of these drugs to treat affected people.
The WHO itself has limited resources. It wants its move now to galvanise governments and agencies in the affected region and beyond. Nick Childs, BBC News.